Now we'll be talking about the signs, the symptoms of smoking. Now I was supposed to talk about signs, but signs are the ones we are going to find out when you come to the hospital. So the symptoms you're going to present with, as a smoker, sometimes you discover that you're not feeling yourself like your normal self because you've been smoking for long. So the symptoms actually ranges from one system to the other, and it affects almost all the systems of the body. However, there's what we call smoker's cough. That smoker's cough is always seen in the morning. You notice that you're having a kind of persistent cough that is small in the early hours of the morning, and most times it gives you chest pain. You understand? To look as if your chest is contracting, that something is compressing, you're losing your breath and all that. So every morning when you wake up, you just discover that you're having this persistent cough. No matter what you do, the cough will still be there. Some of you will go and buy one sweet or the other and take. You want to clear your chest. At the end of the day, the chest will still be there. So it ranges and it affects all the systems. But this one is mostly seen in people that are chronically smoking. You notice this persistent cough. Once that cough is there, don't just do anything. Come to the hospital so that you'll be properly diagnosed and treated. Another thing you could have is chest contraction and pain. You understand? Then you could develop weakness. Some of you will develop red eyes. You wake up and your eyes are becoming reddish more than it's supposed to be. Then some will be having drooling. Then there will also be tearing, as in tears will be coming out from your eyes abnormally. So when some of those things set in, then some of you, if you look at your fingers, you see that your fingers are becoming as black as the smoke itself. So those are some of the things you're going to notice. Then you notice generally, then even as a man, you notice that you're becoming weak in performing your man duty with your woman. So those things could also be as a result of chronic smoking. So the best thing to do is just to report yourself to a hospital. Don't die silently, because one of the mistakes most of you do is after smoking chronically and you develop some of these symptoms, you rather go to a chemist. You go to your village and meet one chemist and tell the chemist, please, I'm having this. The chemist will give you this and give you that. Then after taking it, you feel relief, not knowing that you're compounding your illness. So the best thing to do is, once you begin to have some of these symptoms like cough, weakness of joint, breathlessness, like you're losing your breath, you're generally weak, and your chest is paining you, you're feeling compression as if somebody is compressing your chest, you're feeling as if when you sleep in the night it will look as if somebody is pressing you down, and you wake up in the morning, you develop a kind of cough that is persistent and nothing relieves your feet. Please just come to the hospital. Don't go to that your village chemist. I'm not saying that your chemist is not good though, but just come to the hospital so that you will not die a useless death. So please, whenever you see some of these symptoms, ranging from headache, fever, and the rest of them, whenever you begin to develop some of the symptoms, please come to the hospital. We are always there to help you. Thank you so much for watching. I hope to see you in my next video, and I wish you also kindly consider to follow me on my YouTube page, my Facebook page, my TikTok, and my Instagram.